New question, the member from Halton.
Question is for the Premier. The eHealth scandal has cost you a second minister, Premier. Now that George Smitherman is out of cabinet, now the member for Toronto Centre.
Reminded the honourable members to use riding names, please.
Now that the member for Toronto Centre is out of cabinet, he doesn't have to answer who got rich off taxpayers' money, how they are connected to the McGuinty Liberals, and why a senior public civil servant who blocked the auditor's investigation wasn't disciplined. The $837 million wasted by the member for Toronto Centre wasn't their money, it wasn't your money, it was the hard-earned money of Ontario taxpayers. Why are you rejecting our call for a public inquiry and standing in the way of the public knowing who misspent their money?
Speaker, Ontarians expect their tax dollars to be spent wisely, and so do I, and so does our government. That's why we have moved forward to enthusiastically embrace the recommendations of the Auditor General. We have greatly reformed our procurement policies. This is the right thing to do, and I thank the Auditor General for making the case that it's something we should do. We've curtailed unnecessary expense claims. We have additional mechanisms for accountability and transparency. Very important to acknowledge that we are proceeding with the implementation of eHealth. It's critical to the sustainability of our healthcare system that we embrace the technology through eHealth. That's why we're expanding the number of doctors who will have access to the eHealth technology. We know that patients get better care.
Supplementary.
Minister, you know that you tied the Auditor General's hands during the inquiry. The Premier knows who got rich off taxpayers' money because the McGuinty Liberals did the deals. The Ontario taxpayers who are footing the bill for the billion-dollar boondoggle don't know. I'll be introducing the eHealth Ontario Spending Accountability Act later this week. Will the Premier tell his caucus to give swift passage to my bill and order the public inquiry now?
Minister.
Speaker, the successes at eHealth are significant. All of our hospitals now are filmless. The day of the old X-ray films are over. All of that imaging is done digitally. This is better quality and much less expensive for us. We have 4 million Ontarians already with electronic health records, and we're moving to bring 6 million more over the next 3 years. We have a drug profile viewer in our emergency room so that emergency room physicians can very quickly find out what drugs have been prescribed to a patient in their emergency department. These would include patients who are recipients of the Ontario Drug Benefit Plan, so our seniors, our people with disabilities, people in social assistance, and so on. The RFQ for our diabetes registry closed on August 28th, and those responses.
New question.